Doctor, I would like to ask you that COVID-19 boosters have been in the center of discussions related to the sudden rise in heart attacks. Can you please explain if there's any relation between the vaccines and cardiovascular diseases?
So now you're going to get me into trouble because this is a very, very controversial topic. But I'll tell you, what science has gathered in a very unbiased manner.
Good evening. I'm joined by Dr. Atul Limay. He is a senior consultant of cardiology at Fortis Hospital, Mumbai. Thank you, Dr. Limay, for talking to the pro.
Sure.
Yeah. Doctor, I would like to ask you that COVID-19 boosters have been in the center of discussions related to the sudden rise in heart attacks. Can you please explain if there's any relation between the vaccines and cardiovascular diseases?
So now you're going to get me into trouble because this is a very, very controversial topic. But I'll tell you, what science has gathered in a very unbiased manner. And and that is that the answer is a little bit nuanced from my reading of the literature. What do I mean by that? What I mean is that there is no doubt that the vaccines have been a tremendous progress in terms of reducing the risk of hospitalizations and in terms of reducing the risk of severe COVID. There is no doubt about it. And I think that it is also unquestionable that folks who are immunocompromised, folks who are at the highest risk of getting bad effects of COVID, getting a bad COVID pneumonia or being hospitalized, are definitely helped by this vaccine. Where does the nuanced part come in? The nuanced part comes in young, healthy adults, where there have been some recent studies, particularly out of the US, where the mRNA vaccines are in vogue, which have shown that the mRNA vaccines have had some high incidence of myocarditis, particularly in young adult males who are less than 20 years of age. So I think a nuanced answer to your question is that yes, we need to be careful when we are doing, boosters and, third booster or a fourth booster in otherwise young, healthy males. But I think that if you are over the age of, let's say, 60, and you have diabetes and you are obese and you have other risk factors that put you in the high bracket for a risk for COVID hospitalization, I think there is no doubt that you should be taking the vaccine.
Yeah, because vaccines have helped us a lot during the pandemic. They have been scientifically proven. It has got us out of where we were a year before. What is your observation regarding the rising number of patients complaining of an heart attack?
So, yes, it is true. And I'm sure you've read media reports as well of a sizable number of celebrities in their relative youth, in their 30s and 40s, who've been having, acute heart attacks. Many of them have actually succumbed to it as well. And therefore, there has been a heightened awareness of the fact that in our subcontinent, particularly in India, we are witnessing a rise in the number of young people who don't have the traditional risk factors that we generally ascribe to, such as cigarette smoking, diabetes, hypertension. These young celebrities, seemingly, at least as far as we know, do not seem to be having any of the traditional risk factors that are associated with heart disease. So it's a little surprising that seemingly healthy people seem to be having these heart attacks, particularly in connection to their going to the gym or in being involved in some kind of exertional activity. And I've thought about this as much as other people have, and I don't think there is an easy explanation as to why this is happening. I think Southeast Asians in particular, it's quite well known that we are prone to heart disease. I think part of it is genetically determined. Part of it is the attribution to our diet and lifestyle, particularly, even when we have people who are vegetarians, their diet is very rich in either processed foods such as calorie rich carbohydrates, or their diet is rich in cholesterol, oils, and fats,
Yeah,
and their diet is.
but the discussions on the spate of heart attacks come up when it is widely reported. Have we been ignoring such signs that were possibly warning us about these for a long time?
Well, I think that individuals need to certainly be more aware of these lifestyle interventions that they should do, number one. And the second thing is they should also be aware that periodically they should have blood tests done that indicate what their cholesterol level is, whether they are diabetic or not, because diabetes is a silent disease. Many a times you don't even know you have high sugar. So the classic signs of increased thirst and increased urination, etc., are not present in everybody. Unless you test, you don't know. So I think it is a good idea to periodically have some blood tests to check whether or not you have high cholesterol, whether or not you have high blood sugar, as well as check for high blood pressure to see if you have any of these predilections for heart disease.
So another question: like when it comes to India context, how different it is for a person living in the north and the south? Does the climate, like pollution, for example, Delhi has, where I am, where the probe's office is, Delhi has a lot of pollution. So does it differ for the person who is staying in the north and south of the country?
Yes, there have been a spate of studies that have attributed pollution as a risk factor for heart disease. There is no doubt about that. And the incidence of heart disease, therefore, is going to correlate with the incidence of pollutants in the atmosphere. And so, Delhi or the NCR region, for example, has been, particularly in the winter months, sees a high density of particulate matter or a high density of air pollution. And therefore, the incidence of heart disease, I would imagine, would be higher in more polluted areas as compared to the less polluted areas, all things being equal.
Yeah, as you mentioned, what are the symptoms? Like, can you elaborate on the symptoms we should be looking for, we should be aware of in order to take precautions, and what are the precautions?
The traditional symptoms of heart disease are chest discomfort, particularly on exertion. So suppose, for example, if you are used to walking a 30-minute walk at a particular pace, and you find one day or over a period of a few days or weeks that you are easily getting tired and you are unable to finish your fourth round of the small garden that you're used to walk in, and you're having chest pressure or chest congestion earlier than usual, that is a warning sign that you should go see your doctor, maybe have a stress test or an ECG done, and see why you're having those symptoms. Are they just an innocent acid reflux or heartburn, or do they indicate something more serious such as heart disease?
Uh, According to you, is there any particular step authorities like the government, local governments can take to spread awareness, or at least take a step towards making it sure that the numbers don't rise hereafter?
Well, I think there has been, and continues to be a lot of efforts in the public health arena in terms of trying to educate people to eat a heart healthy diet, for example, to exercise at least 30 to 40 minutes, 5 days a week. I think there has been a push, but the human nature is reluctant, and the willpower and the even though the education may be there, but the willpower to exert that is sometimes not there. And a lot of times when I interview my patients, I don't blame them. They get up in the morning. Some people commute 2 hours to work. So if you wake up at 6 and you have to be on a train or a bus, and you have a 2 hour commute to where you go to work, and you do the same thing at 6 p.m. in the evening, I can't blame them for telling me that there's no time for them to exercise. But having said that, I think all of us need to be conscious and need to take out that time. And I advise people, particularly workers in factories or executives, to maybe take out time during their lunch break and go for a walk during their lunch break, or the last stop of their bus stop. Maybe they can walk that last 15 minutes to work and get down one stop early. You know what I'm saying? So, some sort of exercise can therefore be instituted in your daily lifestyle rather than having the luxury of going to a gym or the luxury of spending an hour in a public garden or the garden of your society. I think that we also need to be conscious of the denominator. So what I mean by that is that I don't think we ought to be alarmed by seeing some of these celebrities making the news because they went to the gym and died. I think if you look at the denominator, which is the total number of people who are exercising or are involved in physical activity, the number of people who get into trouble are minuscule. A very, very, very small fraction of the total number of people who exercise are getting into trouble. So I want to give out the message that exercising is not bad in and of itself. So don't get the wrong message. I think exercising is the right thing to do. You just have to be smart about it. If you're having any symptoms, or if you're going to engage in high level, high intensity activity, I think it is a good idea to see your doctor, maybe get a stress test done before you embark on those high intensity activities.
Thank you, Dr. Levi.